Imagine remedies that have stood the test of time thousands of years, in fact passed down through generations across the world. From mysterious ancient Egypt to the wisdom-filled traditions of India and China, these ancient healing methods were once dismissed as folklore. But guess what? Modern science is now backing up what our ancestors always knew. Today, we're diving into 5 ancient healing secrets that have been scientifically proven to work. Get ready to be amazed by the power of ancient wisdom. Acupuncture China, 2500 before Christ, origin and development. Acupuncture is a core component of traditional Chinese medicine TCM, with roots that go back thousands of years. The oldest known texts, such as the Huangdi Nijing, describe the theoretical foundation of acupuncture. The philosophy behind acupuncture revolves around the concept of qi, life energy, and the balance between yin and yang forces in the body. It is believed that qi flows through meridians in the body, and that illness arises when this flow is blocked or out of balance. Acupuncture was developed to restore this energy balance by inserting needles at specific points along these meridians. Scientific support. Acupuncture is one of the most studied alternative healing methods. Meta-analyses and clinical studies have shown that acupuncture can be effective in treating chronic pain, such as back pain, osteoarthritis, and migraines. The World Health Organization, WHO, recognizes acupuncture for the treatment of certain conditions. Studies suggest that acupuncture may work by stimulating the nervous system, leading to the release of neurotransmitters and endorphins, substances that provide natural pain relief. Advantages: non-invasive and with few side effects, effective for pain management and stress reduction, can be used as a complement to conventional medical treatments. Disadvantages: effectiveness varies from person to person and condition to condition. Risks such as infections or injuries if performed improperly. Its mechanism of action is not fully scientifically explained. Number 2. Ayurveda India, 3000 before Christ. Origin and development. Ayurveda is a traditional medical system from India that dates back more than 5,000 years. The word Ayurveda is derived from the Sanskrit words Ayur, life, and Veda, knowledge, which together mean the knowledge of life. Ayurveda was developed by the sages rishis of ancient India and was first recorded in the Vedas, particularly the Atharvaveda. Ayurveda considers the balance between the 3 doshas, Vata, Pitta, and Kapha. These are essential for health. What about the scientific support? While Ayurveda as a whole is difficult to test using Western scientific methods due to its holistic and personalized approach, many individual Ayurvedic herbs and treatments have been studied. Turmeric, for example, has been extensively researched and has anti-inflammatory and antioxidant properties, primarily due to its active ingredient curcumin ashwagandha. Another widely used Ayurvedic herb has been shown to be an adaptogen. Advantages: meaning it helps the body cope with stress to health, encompassing body, mind, and spirit. Use of natural and generally safe herbs and treatments. Ayurveda offers personalized healing methods based on an individual's unique dosha type. Disadvantages: lack of extensive clinical studies to prove the effectiveness of all aspects of Ayurveda. Some herbs may interact with conventional medications. Application requires extensive knowledge and expertise. Incorrect diagnosis or treatment can be harmful. 3. Remedies from traditional Egyptian medicine, 3000 before Christ. Origin and development. The ancient Egyptians were known for their extensive medical knowledge, often recorded on papyrus scrolls such as the Ebers Papyrus Ka, 1550 BCE. One of the oldest and most important medical texts, the Egyptians used various herbs, minerals, and animal products as medicines. Honey, one of their most valued remedies, was used for wound healing and as a preservative. The antibacterial effect of honey is likely due to its low pH and the presence of enzymes that produce hydrogen peroxide. Scientific support. Honey is now recognized as an effective remedy for wound healing, particularly in the form of medical-grade honey used in the treatment of burns and chronic wounds. Studies have shown that honey can kill bacteria such as Staphylococcus aureus and help prevent infections. Advantages. Honey is a natural antibacterial and anti-inflammatory agent. It is effective in treating various skin and wound infections, can often be safely used in combination with conventional treatments. Disadvantages. Risk of allergic reactions in some people. Not all types of honey are equally effective. Medical-grade honey must be properly processed, should be applied with caution in patients with certain conditions, such as diabetes. Mediterranean and Greek herbal medicine 1500 before Christ. Origin and development. The ancient Greeks, influenced by earlier Egyptian and Mesopotamian medicine, developed their own healing methods. Hippocrates, often considered the father of medicine, emphasized the importance of diet, lifestyle, and the use of herbs. One of the best-known herbs used by the Greeks is willow bark, which contains salicin. Hippocrates prescribed willow bark to treat pain and fever. Scientific support. Salicin, the active substance in willow bark, is chemically related to acetylsalicylic acid, better known as aspirin. The mechanism of action is similar. It inhibits the production of prostaglandins, substances involved in inflammation and pain. This makes willow bark one of the oldest known precursors of modern painkillers. Disadvantages. Can cause side effects such as stomach upset or allergic reactions. Similar to aspirin, not suitable for people with certain conditions, such as ulcers or asthma. Overdose or prolonged use can be harmful. Number 5. Cupping therapy. 1500 before Christ. Origin and development. Cupping therapy is an ancient treatment used in Egypt, China, and other parts of the Middle East. One of the oldest references to cupping comes from the Ebers Papyrus, an ancient Egyptian medical document dated around 1550 BCE. In traditional Chinese medicine, cupping was used to remedy the stagnation of qi and blood in the body, which according to the belief could cause diseases and pain. In cupping, cups are placed on the skin, usually on the back, where they create a vacuum. This vacuum pulls the skin and underlying tissue upward, promoting blood circulation and relieving tension. Scientific support. Cupping therapy is now recognized in certain complementary and alternative medicine circles and has received some scientific support for specific conditions such as muscle pain, muscle tension, and even anxiety disorders. Although the exact mechanisms of action are still unclear, cupping is believed to improve local blood circulation, which can help reduce pain and promote recovery. Advantages. Can be effective in relieving muscle and joint pain, improves local blood circulation and lymphatic drainage, relatively easy to perform and with few side effects if done correctly. Disadvantages. Scientific evidence is limited and mixed. More research is needed. Can cause bruising and minor skin irritation. Incorrect application can lead to complications such as skin infections. These ancient healing methods each have their unique origin, philosophy, and application, and while not always fully understood, they have been scientifically validated to some extent. They offer valuable insights and complementary possibilities in modern medicine, but their use should always be approached with knowledge and caution.